So hi, this is Dr. Vasquez on a second tutorial. Just joking. These are just many tutorials I think will be important in developing your skills and understanding diseases. Now this is a really great site and I gave you links to it. It's iTriageHealth.com. So make sure you go to it. Once you come up there, I made links on Jammer for this. So if you pick asthma, it's going to bring you here anyway. You're going to see this page, and so as a result of what we want you to do is if you come and it opens it up in the browser, you come over here and you click on that little arrow, you'll get the next choice. And here what you're seeing is basically the different types of choices that you can pick from so that you can have a better understanding of different conditions. So we're going to go through each one of them. There'll be symptom checker, condition checker, medication, procedure, and news. So once you check, you'll see the different choices you're going to get. So we picked the medication. And so up here, you can put the actual medication the patient may be on. And we're going to pick Acupro because it's very popular on the bottom, as you can see down here. And so once you pick Acupro, you come all the way to the end, click on that box. And you're seeing the different, what Acupro is used for, which is a blood pressure medication. We use this quite a bit, especially in diabetics and the general population. So if patient, while you're talking to them, is telling you that they have these kind of symptoms, always think about their medications causing a problem. Now, this particular drug can really cause angioedema, so it can cause swelling of the throat, cough, shortness of breath. While it's good for blood pressure, it may be triggering other issues. And I think since you're talking to these patients, not as a doctor, but as a health navigator, community health worker, you may be able to address some of these issues and help the patient. Again, these are, Acupro is one name, but there are also other generic names that you're going to, brand names that you'll have to also kind of know. Overdose. So let's say the patient takes it. I know we're going to call 911, call the poison control, but these are the symptoms that they may be having at the time. They may have lightheadedness and they're on these medications, and so having a good understanding of that is helpful, and that's why going through these different scenarios for the conditions that you deal with, it's helpful. Now you may say, well, you know, the patient tells you I forgot a dose, what should I do? And this is a nice recommendation you can do. You're still going to talk to the doctor, but it's something that you can at least notify the doctor and tell the patient to do, or call the doctor and ask if these things can actually take place. You may be at a person's home and they may have the medications. This is stored at room temperature, but there are some medications that should be stored in a different way. So again, a lot of information that you can help once you're seeing the patient and managing their care as a health navigator and a community health worker out there in the home that may see some of these issues and are documenting and letting us help them with coordination of care. Again, so that you begin to understand what's expected of you. So we went with the other choice was the different procedures, and we're picking bone density. Again, hit the little arrow area, and you start to see not only cost, but who orders these tests, the possible complications, why are we doing this. And the images are really good. The videos are better because you can describe to the patient why we're trying to do what we're trying to do. Now we hit the new section, and now on the new sections of that, when you're down here and you click and you see the new section, this comes up. Why it's important is so if you click, they have news clips all the time. This one in particular about Ebola, which I know everybody's concerned. So hit the little arrow there, and it goes into what it is, just in case the patient's asking. This is a good source of information. It talks about, how many people have been infected with it, the countries that are affected, how it's transmitted person to person, if there's a cure, and again, bad outbreaks, likelihood of an outbreak in the U.S. All these are important information that you could give a patient and at least give them a little bit of ease as to Ebola itself. And the concerns, and who they can go and what sites are important and what sites are sort of reliable. This is the triage. So if you go to the symptom checker on the left side, also back here where we talked about, if you click in this area, you get these kind of symptoms. And if you hit the little box here, it gives you, we're going to go through this one and a little bit of that one. But the idea is important conditions. So it's giving you the female, male, and you can punch on these and change them. And then some of the symptoms you may want to click. Now, if there's nothing click, you see the choices. It talks about costochondritis, pleuritis, and if you click here, you're going to get the same type of information. At least have an understanding of what's going on. I don't want you managing chest pain, but if it's there, at least you should understand what's going on with the patient. So we're going to go through a couple of scenarios on chest pain because I think they're important. So if we change it to male, in this age group, these are some of the common causes. If you decide to check cough, the same scenario, you notice how they change in terms of diagnosis, and you're getting a better idea by clicking on these sides about these conditions. Again, males without anything, if you click shortness of breath on the next slide, now everything changed. Now we're going to show you a scenario. So let's say some male is having chest pain and having shortness of breath. We're going to go with pulmonary embolism because, again, that will kill someone. Click on this, and it'll start describing it. Symptoms, tests that get done, treatment for it. And again, this requires hospitalization. This is, if they don't get that type of treatment for it, they may die. And then when they're out at home, what medications are being used to treat that. And again, examples of what you're dealing with here, in addition to videos on how this disease progresses. I also wanted to include, because I always come back to GBON, we put all this information on its website, but often people are not going there. So if you click on the Help tab and you go to the Help Tutorials, again, click there, and you get the notice. I mean, so what we want you to do is give the information. This is reliable information. We have it in MedDent, but also on the web to give to the patient that you're not practicing medicine, but you're helping them get health literacy under control. Here you got all the choices we talked about. We're going to play with asthma a little bit. And when you go here, you're not able to play this on the iPad if you press there or the iPhone. But if you're on a PC, it goes through a whole tutorial. It could be an interactive or a self-playing tutorial. Now, what you can do from the iPad is get information on asthma itself. So if you click on this area, this is what pops up. Now, we have it on MedDent, so you can print this out. But if you're on the iPad and you want to send it to the patient, or on the iPhone, this is another option. So what about asthma? It describes introduction, the anatomy. We get into a little bit of the physiology in a simple, basic format. And again, the symptoms that cause asthma. And we'll get into triggers. Triggers are important. You may be in the person's home. It may be very cold, very hot. Again, that's a trigger. Pollution. If they're on certain medications, it may trigger. And unfortunately, smoking. Any smoking of all. Secondhand smoke is also as bad as firsthand smoking. Again, you get into, if they're drinking wine, some of the sulfites in the wine trigger asthma. And I don't know if you knew that. Stress can also be a trigger, so how do we manage that? How do we diagnose asthma? These are simple areas that you can help with patients in terms of health promotions and to decrease health literacy. The use of peak flows, because I think that helps the patient understand how their disease is acting at one particular point. We talked about asthma care plans, and the peak flow is very important. Now, treatment options, again, that'll come down to talking, looking at our medications, talking, if you're a health navigator, with the provider, and making sure patients are taking the meds. One of the areas that's important is really inhaler use. If they're using albuterol, that they're not overusing that. And I think that happens a lot. There's also a little bit of abuse of albuterol out there. Patients that are using other drugs use this as a way of opening up their airways to get more drug. So, we want to use this in the right reasons, but if it's overuse or you're seeing it increase in terms of the amounts they're using per month, that becomes important. And when we're developing the asthma care plans, which the health navigators will play with this, you'll understand that this is a problem if it's not being used adequately. And you should be using one inhaler a year or one every 6 months, not more frequent than that. So again, summarizing a little bit about what asthma is in itself. Now, we also did the same tutorials in Spanish. So if you go there and you click the Spanish tab on this, you're going to see the same thing in Spanish. And when you go to asthma and click, you're going to see the same information in Spanish. And I think for a lot of in order for us to have culture sensitivity and health promotion, Spanish is going to be important. And again, it goes through the same things we talked about. Okay? So thank you very much for listening.